I relocated coming out of a provincial-based health authority leading the IT build for the new children's hospital out west. While I was speaking with my wife and we were looking to relocate back to the Markham area, I noticed Markham Stouffville Hospital had a posting for the role, and it excited me immediately. Many don't know, but I've actually been a patient here at Markham Stouffville. My brother, my mother, my grandfather was in our cardiac wing, followed by palliative. My uncles and my father have all been in the cardiac spaces, so Markham is near and dear to me. Technology would actually help the patient's day or patient experience by ensuring those providers have the technologies and tool sets that they require. Yes, there's certain technologies like wayfinding or guest-based wireless services that aid the patients, but more so enabling our providers with the tool sets and technologies they need to be able to get the job done. So I'd like to believe through my background, while it is technology, an emphasis of my career over the past 15 years has been in healthcare and public sector spaces. I'd like to come at it from a non-technology perspective and being able to offer tools or applications that are provider requested and driven. Technology is rather the solution. We should not be starting there. We should be looking at how we can enable and be a part of aiding our clinical workflows or our patient pathways. It's actually the expectations, and not only the expectations of our providers, but of our patients as well. Canadian healthcare, we have a system whereby we have to appreciate each dollar that we spend inside of technology can potentially take away from patient care, or that can be used in a different model within patient care. Many of our counterparts down south, as income generating locations, are able to be on the forefront of some of the newer technologies that are leveraged. And a lot of those technologies, well, cosmetically pleasing or a cosmetic-based usage, that is the expectation of the day. And why Markham means quite a bit to me. Just down the hall from my office, I walk by that space daily. It was a space I purposely stopped by and looked at when I came through my interview process. I was quite close to my grandfather, and it's one of the final spaces I saw him in. So you have that personal attachment. It doesn't matter how difficult the day, we simply need to look out our doors of our offices and realize our patients and their families have it much more difficult, and that helps me refocus and retask. Family and community. I like to pride myself on trying to be the best father I can be. I spend a significant amount of time with my wife and my children, and it's actually why we've moved back into Markham or into the York region area, is to actually have a closer association with our families after being out west for 13 years.